Hi Zachary, my name's Carrie. I'm the nurse practitioner that's going to be examining you today.
Oh,
Did you come here alone?
no, my dad's in the waiting room. He can come in after that.
Okay, great. So I'll talk to your dad after we finish the exam. So tell me what brings you in today.
Yesterday I started feeling a lot of pain in my stomach. I thought I could sleep it off, so I went to bed early. Then I woke up around 4 in the morning with a lot of sharp pain in my belly button. And then around 8 in the morning I woke up again with nausea and vomiting. So that's when I decided to come here.
Okay. So show me exactly where the pain started. Can you point to it?
Right here.
Right
my
there.
belly button.
Okay. And where is it now?
It's like my right side right here.
Okay. Is there what does it feel like? What is
It's like almost like I'm getting stabbed.
like
right
a
here,
stabbing pain? Okay. How severe is it if you had to rate it on a scale of 1 to 10?
I'd
10
say
being the worst pain.
Probably a 10.
10. Is there anything that makes it better?
If I just lie completely still and don't move, it makes it feel a lot better.
Okay. And what makes it worse?
Just moving in general.
Oh, really? How was the car ride here?
It's horrible.
Bad.
I couldn't bear it.
Okay. Have you had any other symptoms associated with it? Like, have you had a fever or chills or diarrhea?
I've had a fever and I've been vomiting.
You've been vomiting? And did the vomiting start before the pain or after the pain?
After the pain.
After the pain? Can you cough for me? Oh, that hurts? Okay, so it hurts to cough. How has your appetite been prior to this?
Fine. Eat normal.
You're eating and drinking normally? Okay. And since this pain started, have you been able to eat or drink?
No.
All right. And have you lost any weight recently?
No.
Have you traveled out of the country or traveled anywhere, out of the norm?
No.
No. Have you had a recent cold or a cough or any shortness of breath?
No.
No wheezing? How about chest pain or palpitations?
No.
Have you had any reflux or indigestion?
No.
And how about your stools? Have they been normal? Have you noticed any change in them?
No changes. Normal.
They had no blood in your stool? Any trouble urinating?
No.
No. Do you have any chronic medical conditions?
No.
Do you use tobacco or alcohol or any kind of street drugs?
No.
All right. Do you take any medications, even over the counter, like ibuprofen or Motrin?
No, I just take a multivitamin.
Okay. Anyone in your family have any problems with their stomach?
Not that I know of. No.
Okay. Well, I'm going to check a few other things before I check your belly, so I'm going to take you into the exam room and have you get changed.
Okay.
Okay, Zachary. Let's see if we can find out what's going on with you. Okay. First, I just want to check the white part of your eyes. Look up for me. Okay. I'm just going to feel your lymph nodes. I'm going to listen to your heart. You can breathe normally. Just going to pull this down. Just sit up for me. I just want you to breathe in and out through your mouth. I'm going to have you lay down for me. I know that's sore. Okay. Can I scoot you back in here a little bit? Okay. I'm just going to look. I'm just going to listen. I'm just going to pull these down a little bit. Oh, does that hurt? I'm sorry. I'm just going to feel over here. Does that hurt worse when I push in or when I let go? Okay. Does it hurt? Okay. Can you lift your leg up? Is that where, or is that causing you pain? Where's the pain? Okay. Too much pain? Okay. Let me have you stand up for me for a second. Can you stand up on your tippy toes? Can you drop down on your heels? Too much pain there? Okay. I'm going to have you sit back. Well, class, now I'm going to do a testicular exam and a digital rectal exam. And I'm not going to do that to my son, nor am I going to put it on video. So, Zachary, I'm going to consult with my colleagues and my attending, and we're going to see if we can find out what's going on with your belly pain. To recap our patient, he's a 17-year-old male who presented with acute onset abdominal pain. The pain began last evening and got progressively worse over the course of the night. And around 8 o'clock this morning, he started with severe pain and some nausea and vomiting. He also was running a low-grade fever of 100.6. He had a positive Dumpy sign, which is when I asked him to cough, it elicited a pain response in his right lower quadrant. Upon percussion, he was tender in his abdomen, and when I palpated his left lower quadrant deeply and then removed my hand, he had a positive Rovsing sign, which is pain in the right lower quadrant after release of deep palpation in the left lower quadrant. He also had a positive psoas sign when I put my hands on his right thigh and asked him to lift his leg, it elicited a pain response in his right lower quadrant. He also had a positive obturator sign, which was when I flexed his knee up and internally rotated his hip. That elicited pain in his right lower quadrant as well. He also had a positive Markle sign when I asked him to stand on his tippy toes and then drop down to his heels, and that caused him pain. His testicular exam was negative. His digital rectal exam was negative for blood. However, it was positive for tenderness. So, what do you think our patient's diagnosis is, and what's next? How should we treat him?